Hello and welcome to MagnaWave Office Hours. Pat Zemer here with MagnaWave. Come to you on Tuesdays to answer your questions with regard to MagnaWave, PEMF, machines, training, anything that it may be. We're here to discuss a lot of interesting things going on as we get into the holiday season here. We're just glad to be here with you. So if you have a question, please put it in the chat box on Facebook or YouTube, and it'll come up and I'll be able to have a look at it and give you your answer. If you'd like to talk to me, simply send a text to 502-599-9722. 502-599-9722. I'll give you a call back. We can have a conversation and discuss anything that it is that you would like to discuss with regard, again, to MagnaWave or anything you have. If you would be so kind as to share this with your friends so more people can join us and have their questions asked as well. Just share this with your friends. And if you'd like to talk with me, 502-599-9722. In the spirit of the holiday and in giving thankful times and so forth for our families and everything going on around us, we have a contest that we're having. It is hashtag thankful for my MagnaWave. Hashtag thankful for my MagnaWave. Put something in there with that hashtag, put a post with the hashtag, and we're going to take the best one or the most exciting one and give a prize next week here on the program. So again, it's hashtag thankful for my MagnaWave and what your thoughts are with regard to that. So participate with us and we'll enjoy that going on. As you know, the Spiro Go is now available and out for you to have a look at. And we're excited about the Spiro Go, and it's doing very well as we move into the new machines that are coming and new controls and all kinds of things on the horizon that we're very excited to participate with. Let's have a look over here and see if we've received any questions at this point. Northern Lights is with us. Good morning, Sue. Idle Hours with us. Don Weifels. Dion is with us, and Don is with us. Will the light or MW help a dog with spindle cell tumor? Will the light or the MagnaWave help a dog with spindle cell tumor? Well, we've learned that the MagnaWave is very beneficial for the reduction of inflammation, and we've seen tumors in animals reduce in size almost immediately. Dr. Marty has discussed that in his presentations that he's made with us at MagnaWave, how he has used the MagnaWave PEMF for tumor reduction as so forth. So, each thing is different. If you have a dog that has that type of situation, certainly check with your veterinarian or the doctor and get their thoughts and see what you might be able to do. But we've seen very promising results with regard to tumor reduction. The light as well can help with the blood flow around the area, and that could be beneficial to that situation as well. So, it's a matter. Each animal is different. Each situation is different. Certainly check with your veterinarian, but there's promise that it could be beneficial in aiding the reduction of the tumor, which could slow its growth, slow its progression, so on and so forth. And so Idle Hour says, loving the Spiro Go. That's exciting. Good afternoon, Joyce. Thank you for being with us. Bridget is with us, and Sherry is with us from Pennsylvania. We're glad that you're all here. If you have a question, simply put it in the chat box, and I'd be happy to answer your questions accordingly. Or, as we pointed out, if you'd like to talk with me, 502-599-9722. And I will give you a call back and we can have a discussion accordingly. Good morning from Chicago. There was the doorbell rang a moment ago. Let's see if it's somebody with the messages, maybe, if they want to talk with us. Okay, yes, let's Jane. Let's give Jane a shout here and see what we can find out and what she would like to discuss. Here we go.
Hello, this is Jane.
Hi, Jane. Pat Zemer here. How are you?
I'm good. How are you doing today?
I'm great. You have a question?
I do. I am a friend/client that is recovering from COVID, and it's been over 2 weeks. It wasn't serious enough to be hospitalized, but it's kind of gone through their household. And she's still experiencing the headaches and some temperature. And I wondered if maybe putting this on her a little bit would help.
Well, go ahead.
I was going to say I have the semi.
That's fine. Perfect. Yeah. We can't talk about using something like this. It's not a cure. It's not going to do anything like that. But the device has been known to show a sense of well-being. It does promote inflammation reduction, which can be a cause of a headache. It does improve blood flow, blood oxygenation. We've seen an increase in blood oxygenation, all of which can be beneficial for inflammation reduction, better flow in the lungs, better breathing, so on and so forth. So would it be something that could provide comfort and relaxation? I think most certainly in that type of situation would be a way to utilize the device for comfort, relaxation, and potentially helping their body heal itself more rapidly.
Okay, well, that's kind of my thought, and I just wanted to make sure I wasn't going to make her, have a renewal or
there's no reason that it's no different than rubbing someone's back and helping them feel better and get good blood flow from that, or other things that you might do, a massage or anything like that. So it's really no different than that. So you're going to help these people have a sense of well-being, feel better, and allow the body to be in a better position to recover.
Okay, I thank you very much.
Okay, send an email to support@MagnaWave PEMF and you'll be included for today's drawing.
Thank you so much.
You're welcome. Thank you for calling. Bye-bye.
Goodbye.
Okay, there you go. Great question. 502-555-502-599-9722. If you'd like to visit with me and we have a discussion. Let's see, got some other questions here. Good morning from Mississippi. Angie's with us. Tim's with us this morning. Donnell is with us. Let's see. Firsthand experience that has helped with decreasing the headaches and congestion. Donnell talks about. Jeff's with us. Good afternoon to Jeff. Christine asks, can a practitioner who works every day get too much exposure to PEMF? And, we've been asked that question a lot. And there was another question that was asked in the practitioner portal about people wearing jewelry that's supposed to help protect you from the EMF. EMF and PEMF, even though there's three letters the same in both of them, are two different things. EMF is the dirt, if you will, or the bad problems, or the bad stuff that you get from continual microwave or continual electromagnetic exposure, like the whole high voltage lines that run off over us, people sitting in front of their computers for hours a day with the signal emitting continually and not stopping. PEMF, on the other hand, is pulsed nanosecond bursts of energy that go to the body. And as Dr. Pollack has pointed out, in many cases, PEMF helps erase the effects of EMF or electrosmog has on the body. So in a sense, the PEMF is a cleaner because it helps detoxify the body. It helps get this stuff that is not good for it away. And PEMF is not electrosmog. PEMF can help rejuvenate the blood function, help rejuvenate the oxygenation, help detox the body, and thereby moving some of this stuff away. So some people, if they're around it all day long and they're treating continually, everybody is different. Could it cause some fatigue in your muscles because you're standing there treating all day long? I experienced that back in the days when I was treating all day long, all week long, 7 days a week. I would get tired and so forth. Some people with their exposure have felt at the end of the day, maybe they're having headaches or something like that. But is it a situation to where you can get too much exposure? It takes, and it's been mathematically worked out to show this, and I'll use two numbers, and many of you have heard me say this before, but it takes 17 hours of continual exposure. In other words, you turn that thing on and hold it at your body for 17 hours. Let me use two numbers. The first number is to get a minute of exposure that you would receive from your computer or from a microwave or for the power lines overhead. It takes a long time, 17, 18 hours to get 1 minute. It's not a minute, it's a second. And so people have a hard time wrapping their head around it. So for all intents and purposes, people have been doing this. I've been doing it for over 20 years. I've never watched how much I do it in a day because I'm not holding it directly on myself. I'm holding it out on a person or an animal or a dog, and I'm not getting the full concentration of what's going on, first of all. Second of all, it is the distance, and it is microsecond or very sharp bursts of energy. So it's very rare for anyone to have. In fact, I can't think the last time I've talked about someone and had very adverse effects. We have had some people, 1 out of 100 people have a toxicity level or have a resistance to electromagnetic fields or electric fields that they're very uncomfortable. These are people that feel uncomfortable sitting in front of their TV, if they're living near high voltage wires, and they feel, their body feels that electro activity, and they're uncomfortable. So those people can become uncomfortable around PEMF. It happens. As I said, typically 1 out of 100 people, you'll put it on, they just don't like it, they're not comfortable, and it's just not for them, no matter what the setting. That can be the case. Also, in people who are have higher toxic levels, higher levels of toxicity, are a little bit more sensitive to the device than others. But if you use it as a detoxifier to help clean the animals or clean what's going on, clean out their systems, it can be beneficial from that standpoint. So to answer your question, typically not too much to use it on a period day. I never had that situation personally. If you've had some situations, please, if you'd like to discuss it, let's do. Carrie's from Minnesota. John's with us. A client has numbness in her face. She's had an MRI and no issues such as stroke or Bell's palsy was found. Could the PEMF bring back sensation? Any potential issues? I would think that if someone is having numbness, and again, check with the doctor, but I don't know that it would contribute to the numbness. This is going to help the blood circulation, help things return to normal. You know, people use it on neuropathy type of conditions in their hands and their feet to improve the circulation, to relieve the numbness that's felt, and so forth. I did that personally. I had what my doctor called age-related neuropathy, numbness in my lower legs and feet and tingling, and I treated myself daily for months, and it took, finally, I was getting results immediately, but it really took months of treatments to where I don't even treat myself at all for that situation any longer. I just continually treated. So same thing, people that have had Bell's palsy, to treat their face to feel better, people that have experienced strokes or those types of situations to get some return to normalcy could certainly be available. Again, you always want to check with your doctor when you're talking about those types of situations. And could it help? You know, the NASA study, other studies have shown that it has served or been shown to help with some nerve regeneration and feeling. So again, every animal is different, every client is different, and so you need to try and see what the situation may be. Great question, though, John. Thankful for my MagnaWave being able to help family, friends, and pets to feel better. Well, great, Sue. Thank you for sharing that. Christine is with us also. Hello from Minnesota. Carrie's with us. Good afternoon. Scotty's with us this morning, and John's with us as well. So if you have a question, simply put it in there. If you'd like to send me a text, I'd be happy to give you a shout back, and we can discuss whatever it is that you would like to talk about. Again, don't forget the hashtag thankful for my MagnaWave, and give us some things that you're thankful for with regard to your MagnaWave, and you'll be entered into the contest for a prize that we'll be giving away next week. If you call me and I call you, you'll also be entered to receive a gift bag today for those who give me a call and we have a conversation. Let me come back here. Let's see. Okay, there are some questions that I maybe missed. Let's see. Dion says, I have COVID now. My MagnaWave has been a lifesaver for all of us. Works great for my headaches and really well for the horrible leg pain my husband and I had or have. And, you know, circulation is an important part of any type of situation that you get in with regard to healing and recovery. And so can it be helpful from that perspective? I can tell you that what I'm doing and what I used during the COVID, I sleep on my B2, and I rest my back on it, and I can feel it, and I feel that I'm helping my blood flow in my lungs and helping myself hopefully stay healthy during this entire process, to just my recovery and everything from anything to aid in that type of situation. Let's see. Okay, my dad just had a second carpal tunnel release surgery yesterday. I wanted to start working on him as soon as possible. Since there is no bleeding, can I go ahead and use a low setting to increase healing time tonight? or should I wait another day or two? We did a session 2 days before the surgery. Jessica, if the bleeding has stopped and he wants to use it to have some comfort in his wrist, hand, elbow, shoulder areas, whatever may be affected from the release surgery, you're going to help the inflammation reduction, help the feeling of less pain, and I would certainly proceed. Again, check with the doctor. Check with the doctor. But in the absence of bleeding, you're pretty good. You don't want to do anything that can enhance the bleeding or slow the bleeding from ceasing. You want the bleeding to stop, and then you can easily prepare and move along with the healing process that we are looking for in those types of situations. Okay, let's see. Okay, the hashtag thankful for my MagnaWave, there's one right there, as well as health and animals. Put that in here, but also post it on the Facebook page or YouTube page. That would be great. I guess you're doing that. If I'm seeing it on the restream, you're posting it there. Never mind. It takes me just a minute sometimes to catch up with everything that's going on here. I'm forgetting, I'm looking at your responses on Restream. I'm not actually looking at the Facebook or the YouTube page. I'm looking at the Restream, and that's why I'm seeing these. And so you are posting them where you're supposed to share your MagnaWaves on your pages for a chance to win. Okay, they're going into that as well. All right, any other questions, sent them, simply put them in there, and I'd be happy to have a look at them. Let me take a look here on my Facebook page and see if there's any questions that folks have had. How do I get there to my group pages? Hello. Let me get to my group. Well, as we go, here we go. MagnaWave Certified Practitioners. There is a post on the group this morning. The MagnaWave app password reset feature is active. So if you've had some problems getting into your MagnaWave app, you can go in there now and click the reset my password, or I forgot my password, and it'll allow you to reset your password easily. Any other questions? Put them in there, please. Oh, here's somebody that would like to, someone calling at the door. Let's see who we have here. All right, question with regard to acid reflux. Let's have a listen here and see what their question may be.
Hello.
Hello, good morning.
Yes, good morning. What my question is that I've got my husband. He has got a pacemaker, and he also has he's got a pacemaker, and he's had like a whole bunch of, heart issues and stuff. And I want to make sure, because I know it says that he can't be around the waves or anything, and I don't want him to be, I'm not sure, I don't want him to be around like the 6 foot area, or can he be in that area, or does he have to be like in the 40 inches, inches away from it?
Well, you don't want to. How old is his pacemaker?
He's had a pacemaker now for about 18 years.
Okay.
And he's already had it replaced a couple times.
Okay, so basically, it's the precautions are you want to be a few feet away from the device, and that's just as a safety precaution, and that's a very good thing. So I would say if he's in the room, he's okay. If he's 5 or 6 feet away, that is fine. If he steps up to 40 inches and there's a treatment going on, it's not going to set it off or anything like that. So it's not like it's oh my gosh, he's in the room, we got to be careful. But you just don't. So I would use caution. Certainly keep the coil away from the pacemaker. But if he walks through the room, or if he's sitting across the room, that's fine.
Okay. I was just wanting to know, because he may sometimes go out on calls with me, and I didn't want him to, feel bad or whatever,
Right. No, and
make him stay away 6 feet.
No, it's just an extra precaution that we're trying to be careful of, so everybody, is comfortable with what's going on. That's the way to look at it.
Okay. Well, thank you.
You're welcome. Thank you. Have a good day.
Bye-bye.
Bye-bye. Send your email to support at MagnaWave PEMF, and you'll be entered to win the contest for today. about your B2 machine. Let's see. Let's get him on the line here. We have a question. I'm going to talk about the B2.
Hi, it's Becky.
Hey, Becky, how are you?
Good.
And you have a question.
So, yeah, you talk a lot about using your B2 machine, and I've read up on it on the website. But can you just give a quick down and dirty about why, as a practitioner, it would be an advantage for us to purchase it?
Okay. Well, that is a great question. As a practitioner, for you to use in your practice, if you've got someone that you're going to treat them, or they're going to be laying on a mat or a massage table, or if you have the Wave Oasis, let's not even talk about that at this juncture, but they could lay on it for 30 minutes or an hour very comfortably and get some relaxation, and thereby getting some PEMF into the body, which could be beneficial. However, it would be more, I use it more on a continual longer basis because it just works well that when I sleep or rest, I can use it. So from a practitioner standpoint, now, as a practitioner, if you wanted to have it and rent it to someone for them to go home and lay with for a couple hours a day after you've treated them to reinforce what you're doing, some very good benefit there. If someone,
that would be a great idea.
Yeah, if someone has a muscle strain, let's say in their shoulder, and they're going to lay on the B2 or put the B2 paddle at their back for a half hour or so, they're going to get some relief, but they're not going to get the relief as rapidly as they would get it from one of the larger machines, say the Soul Up or something like that, the Semi Soul Maya or Max. But from the perspective of supporting what you're doing, it's beneficial. In my case, I wanted to really experiment with the machine. So I had my prostate issue 6 years ago. I wanted to make sure that my lungs are fresh during all the COVID and so forth. I want to, they talk about as people age, and it's a hell of a deal that as I age, I'm trying this stuff out to hopefully not age so much. But at any rate, so I put it on my pillow when we're watching a movie or something in the evening, and I can feel it pulsing on my head, but yet it's comfortable enough and it's not disturbing as we watch television. So I wanted to see what I would get. So I started using it to do that. I was very pleased with my results in that my prostate has remained consistent. The inflammation is not a problem. My doctor's been very happy with my year-to-date, every 6 months, what I'm doing. And the only thing I'm doing now, I still treat myself with the Spiro or the Semi or what other machines, my prostate, not regularly like I did, but periodically. And so from that perspective, I was very pleased with the result in that type situation. So for you to use it as something to send home with someone after a treatment for a week or two could be some very good benefit. If you had somebody if you have a clinic arrangement, or you go to treat someone at their home and you put it behind their husband's back for a half hour while you're treating their dog or their horse or the client's back, just to give them some relaxation and some pain relief, could be very beneficial to that. And it's lightweight, small, not as expensive as the other devices.
If you were to compare like the strengths, say that, like you just said, you were going to use it on the owner while you're treating the dog.
Mm-hmm.
And I have the Mag Energy mats that a lot of times I do that while they're sitting there. Would the power of the results be similar to a Mag Energy mat or different?
It's going to be slower. If you're working with someone's dog and you put them with a separate splitter or whatever on the owner with the Mag Energy mat, you're going to have more power, so you're going to have more rapid result to that.
Okay.
And so, if I was going to make a comparison to a low power unit that are only producing 30 or 50 Gauss, and the B2 produces 500 Gauss, and the Semi or the other machines can get up, depending on the applicator you're using, from 1,000 to 500 to 3,000 Gauss. So you just see there's different powers, different response times are going to be there. But I have found that the interesting thing that I've noticed with the B2 is sometimes when I sleep, I'll sleep in a manner that I get a sore shoulder. And if I just lay back and put that pad while I'm sleeping or, while I'm resting underneath my shoulder in 15, 20, 30 minutes, the pain is relieved, just like it is with the big machines. But I'm able to do it with the small machine.
So you don't use it like automatically when you go to bed and let it run all night?
No, I do. It runs for 8 hours.
Oh, you do?
I do.
Okay.
I put it on,
okay.
and my routine is let's say we're going to go to bed and we're going to watch a program. I'll put it on my pillow behind my head, doing my neck and my head, and so that's for brain health. Then I will move it down, and I'll do my lungs, and I'm thinking for lung health, preventing pneumonia, helping good blood flow through the lungs to maybe hopefully prevent any flu-like things that could be going around. And then I'll move it down and I'll put it under my hips, and I'll treat my prostate and that type of situation. And then in the morning it beeps, and I know that it's been on for 8 hours, and I get up. It's kind of turned in to my alarm clock.
Okay. That helps me a ton.
Okay.
I just couldn't quite compare them to the other ones and why I should own that machine.
If you're dealing with quick results and you're dealing with treatment times for your clients to where the treatment time is important, you can't beat the bigger machines. But if
Right.
you're dealing with a situation that maybe someone's uncomfortable with a big machine, they could put this under their back and sit there and relax for an hour or so and get good pulsed magnetic blood flow into their body.
Perfect.
Okay.
Thank you for your comments.
You're welcome. Thank you so much. Send an email to support@MagnaWave PMF, and we'll put you in the drawing.
P.S. I love your book that I got last time.
Great. Thank you so much.
Success.
Yes.
Pillars of Success.
Yes. Thank you so much. I'm glad you enjoyed it.
Okay.
Mm-hmm.
Thanks.
Mm-hmm. Bye-bye. Okay, good questions that we're dealing with. We do have different levels of machines, from the B2 all the way up to the Max machine, and digital machines and spark chamber machines, the whole 9 yards. And they really are all doing the same thing. The time of result is what varies between devices, and it just which one is best for what you're needing and which one works the best. What I've felt is that the smaller machines and I find myself working with the smaller machines a lot from a testing perspective. Will I get the result I'm looking for with my health and so on and so forth by using the smaller machine? When I have an acute situation, like I was describing, a shoulder, if I go out and work in the yard and wrench my back, yeah, the small machine's going to do it, but it's going to take time. Much more time, a couple hours maybe. And whereas the small machine, I can put it on there for 10 minutes, boom, I'm feeling better and I recover more rapidly, and you go down that. So you look at the whole thing. But from a practitioner standpoint, there's a lot of different variables that you can do. In fact, I'm working with doing a test now. I'm going to start on a test using the B2. Got another caller coming in, using the B2 along with the Wave Oasis. And so it's a situation that you don't feel it at all because it's a lower power machine compared to other devices, but it is providing that PEMF to the body at the same time that we're getting the vibration and the frequency of the music along with the Wave Oasis and the B2. So I'm just beginning that testing procedure with myself, and to go down that road, and I'll have more information on that as we go. A lot of folks with us this morning on Castbox. We're glad that you're with us. If you'd like to listen on Castbox, I'm sure that Emily or Chris will put the link in there. Castbox is like a radio station version of the MagnaWave office hours with no video. You can listen on your phone or as you're driving or whatever the situation may be. Okay, we do, let's see, we do have a caller talking about hip and hock issues. Let's bring them up and see what we have.
This is Sue.
Hey, Sue, Pat Zemer here.
Hey, Pat. How are you today?
I'm good. How are you?
I'm doing well, thank you.
Great.
Say I picked up a client, and she's got a horse that has a hock issue. It's the hock. One of her hocks is starting to fuse.
Okay.
So earlier this fall, I should say fall 2019. 2020. Sorry. She went and she did an injection on the hock, and she's not noticing that the horse is having any problems. But her vet said doing PEMF would help.
Okay.
But the problem is I have a semi-5.
Okay.
Even on low intensity, it doesn't matter whether I use the big loop or the butterfly loop. She lets me have it on that hock for about 30 to 45 seconds before she starts picking up that rear leg. Is it something I'm doing wrong?
No.
Or do I need to not actually put it on the hock itself, but kind of hold it farther away?
Okay.
Because I'm on the lowest intensity. So.
Okay. So you've done two things. Number one, you haven't done anything wrong. Don't misunderstand me. Okay. When the horse picks up its leg, is it just moving its leg, or is the horse walking away?
What she does is she'll move her rear away, and then she picks it up.
And then she sets it right back down and lets you continue to treat.
No, she keeps it up until I remove the coil. The minute I remove the coil, she'll put it back down.
Okay. So there's some sensitivity there for her to do that. What I would do is and you answered your own question, I would hold the coil about an inch or two from the hock.
Okay.
And you're still treating it. You're just not directly on it. And what I would maybe do is put it on the hock for the 30 seconds. Don't, if it's pretty much 30 seconds, put it on there for 25 seconds or so, 20 seconds, pull it away, move it an inch away, an inch or two away. And if she keeps it down, then do that for another minute and then put it back on for 30 seconds and then pull it away. And so as long as she's not walking away from you, it's okay. But so you don't have to be right on it. You get better absorption, certainly, if you're right on it or you're in the area. But obviously, if there is some sensitivity there, the animal's going to move and going to come away from it. So what we need to do is outthink the animal. Put it on for 20 seconds, put it off an inch or two away for 20, 30 seconds or a minute, maybe put it back on for 20 or 30 seconds, move it away. The tissue will respond better when we're approaching it from different intensities at different angles, if you will. I would try that.
Okay. Would it be better then to use the big loop instead of the butterfly?
It's probably easier to use the big loop like that. Yeah. But you could, you're putting the butterfly over the hock. Okay.
I will put it on the front part.
You're putting it on the front. So you're putting it on the front of the hock, not from the back. You're putting it on from the front. I do both. Okay.
I do both.
So what I would recommend if you're going to, I'd try it both ways. If you could put that, let's just talk from the back. If you could slide that butterfly on the hock from the back for 10, 15, 20 seconds, pull it off and hold it to the side. Okay.
Okay.
A couple inches. Put it back on for 10 or 15 seconds, pull it off and put it on the inside 2 inches away. Okay. So if you get to where it will not allow you to put it back on, then just hold it off a couple inches and increase the intensity. If you pull it off in a couple inches and increase the intensity to a 3 or a 4, you're going to get just as much as you were getting in there as if you had it right on the hock.
Oh, okay.
Okay, doke.
I appreciate it.
You're welcome. Thank you. Support at MagnaWavePEMF.com. Be entered for the giveaway.
Okay. Thank you.
Bye-bye.
Bye-bye.
It's just, there's just so many different things you can do and so many different ways you can try to approach what you're doing when you're dealing with the particular animals and how to apply it and how to work around if they have some discomfort and they don't want it to have it on. Some animals who can't stand to be clipped aren't going to let you put this on them. The challenge with clippers is you have to clip. With this, you don't have to. Just hold it off an inch and turn it up a little bit, and you're getting it. If they won't let you touch them with the coil, just because they're that sensitive. So a lot of different ways to get around it. That's why I love to talk about it, because you can call and we can talk through these things, and we'll think of things together in order to give you some aid as you apply your experience to your clients. Okay. Maureen, thank you. I'm glad you like the B2 protocol. Hello, I just set up my new Oasis PMF mat. So excited. When using the mat on my massage table, I can use other machine and another tool like a small butterfly loop on a knee, most assuredly. So you can use another attachment or a second machine. If you're using your Wave Oasis, you can put the coil on someone's ankle if they're having foot problems, or you could put a mat down there if they had neuropathy problems. Put a mat at the very end, let them get the massage, put the mat at the under the feet at the end, and work from that perspective. So again, just as I was describing, you have an incredible amount of flexibility when you use the various attachments with the MagnaWave devices. And I see they put the link in there for the Castbox. If you want to listen on Castbox, we're glad to have the folks with us on Castbox, and we appreciate them being with us as well. We're picking up some better numbers on Castbox each week. So there's the link. If you find that you can't have the video, or you're someplace where you don't get a good enough signal to have video, just click that link on your phone and bingo, you can listen to us just like you're listening on the radio. All right. Any other questions? Let me make sure I haven't got to take care of a client. Have a great week. Amy, thanks for being with us. We appreciate that. How long after knee replacement surgery can you start using the machine? Again, we talk about this a lot. As soon as the as soon as bleeding is under control, there is no active bleeding, you can begin the regimen of treatment. Again, you always want to check with the doctors that you're dealing with for your client, but you can begin at that point. The reason we wait, the MagnaWave has been shown, and PEMF has been shown to improve blood flow. It does not increase blood pressure. So it's not that you're going to force more bleeding or anything like that, but it does just kind of makes the blood flow easier and freer. So if you've got some bleeding going on and it's able to go, it's going to potentially continue to bleed. It's not going to coagulate the bleeding. Now, if you got an open wound that's not bleeding and you want to kind of promote the healing, you can put it over a wound and let it give some good oxygenation and help the blood flow to the wound. So the wound area, the body can heal that wound in a more rapid fashion to speed the healing process. Same thing with a knee replacement. My brother just had a knee replacement and went home from the hospital and began using the machine immediately. And it's been a while. It's his second knee replacement, and it's been a while. So it's kind of snuck up on him. It was a little harder this time than he anticipated. But I spoke with him last night. He had the replacement, I think, last Friday, and he's feeling much better as of last night. And he's using the machine immediately upon his return home from the hospital. So that would be a way to take a look at the knee type situation. There's the Castbox link. If you have a question, put it in the chat box on Facebook, YouTube, and I'll be happy to have a look at your questions. If you'd like to talk with me, 502-599-9722, and I'd be happy to give you a call back and answer whatever questions you may have. Don't forget, hashtag thankful for my MagnaWave, and we'll be entered to win a prize on next week's program. So be sure to do that hashtag and have some fun and win some prizes. Also, don't forget MagnaCon coming up. I believe it's the 12th, 13th, and 14th. Correct me if I'm wrong, of June of 2021. At this point, we're anticipating a live in-person meeting. We may be limited on numbers, but depending on our facility, we'll be back in the same facility we were in last time at the Marriott East in Louisville. We love that. They've done very well, and they can certainly accommodate what we're doing. And we certainly want to plan on having a live event with people in hand. However, we're also going to have a virtual part of the event as well. So if you'd like to get tickets for MagnaCon before the end of the year, you'll save $100. So if you're interested in joining us for MagnaCon, please do purchase your tickets, and we can all have a big time. June 9th, 10th, and 11th. See, I was wrong. June 9th, 10th, and 11th of 2021. Early bird tickets are available. So have a look. The link is there to have a look at your tickets. So we're looking forward to a live in-person MagnaCon this year. Elaine and the crew are working very hard to have some new speakers. We're working, as you know, one of the things I wanted to talk about is Dr. Lyons, University of Denver, did the study on brain concussions and brain healing and brain health, and had some very favorable responses. It was just posted in the practitioner page this week. Perhaps they can put that same type of information on the Facebook page for people to to enjoy, but the results were, the doctor was very pleased with the results. They saw some very good results on the people that received the PEMF, sped their brain healing, helped them recover more rapidly from a concussion type of situation. And we're going to pursue that a little further and go deeper into those types of studies. But that was done with the Pulse Pro machine, the MagnaWave Pulse Pro. And so again, we're excited about that. We have some other studies that we're working on to move forward with different aspects of the FDA and the utilization of the equipment. Question for helping older dogs get around: is it best to treat every day, even twice daily, or better to give a rest day in between? I would treat as often as necessary to keep the dog comfortable. In some cases, that may be every day. What I would recommend if you're just beginning this with your dog is I would treat them probably twice a day for 10 or 15 minutes for 4 or 5 days or 6 days, and then drop off, miss a couple of days, and see how the dog does. If the dog holds well, then you're good. If the dog starts to regress, treat. And then treat a few more times and see how long it goes. You can get to situations where you may have a dog that you treat regularly, and then all of a sudden you don't need to treat it for a week, or you may only need to treat it once a week. The dog will tell you, the animal will tell you, because they start to regress in their movement and their range of motion. And so it'd be very difficult for you to overdo it. Now, you don't want to do it 2 hours a day and get them so detoxed that it's tough to detox a dog, because they're outside, they're eating the grass and the stuff and the dirt, and so they're getting a lot of toxins. So it's tough to over detoxify that type of animal. You can, but if you're treating them 10 minutes a day, twice a day, and that's what's keeping your dog happy and healthy, as long as your vet's happy and everything's going well, you should be okay. But your animal will tell you if you need to do it more often. But don't be afraid to think, well, I can do it 4 or 5 days and I have to lay off a day or two. There's nothing wrong with doing that. And in a human situation, it's best to do that so you don't over detox someone. So take a day off periodically to allow things to remain in balance and stay in type of good shape. But for your older dog, if once a day is great and comfortable, bingo, knock it out. If twice a day is good. We used to have this with our Boxer, lived to be 10, but she had hip dysplasia. And the doctor said, well, number one, it's going to cost you a lot of money to fix his hip. And then in 6 months, we're going to have to fix the other hip. And we didn't do that. We treated the dog and she would stay very good. She'd go out in the yard, and if all of a sudden she'd see a rat or something in the yard and she'd chase after it, she'd come in gimping, we'd treat her and she'd be fine. If she went back out in the yard for a couple of days and didn't run too hard or chase something like that, then she'd be fine. But when she would overexert herself, she would need to be treated. So again, the dog will let you know when they're having a situation, much as you would experience. If you're doing something in the yard and your back is a little sore, you treat yourself. But if you go out and you do normal activities and you're not having an issue, you don't treat yourself. So just kind of think of it from that perspective. Kate, we're glad that you can't wait for MagnaCon, because we can't wait to see you at MagnaCon and enjoy some good camaraderie together. And Maureen says the same for helping older dogs. So yeah, we were just there on the older dog. Treat as necessary. You're not doing anything that is really going to hurt anything. Just keep the animal comfortable, allow the animal to, I know Elaine's dog that she's dealing with, Ella, we really don't know how old Ella is. They kind of have an idea, but she's elderly and she's dealing with age. And so they treat her as often as they need to keep her in good shape. And I was at their home the other night, and Ella was great. Ella's not a pup any longer, and so Ella doesn't act like a pup, but Ella's doing fine. And so you can experience the same type of health with where you're going. Our little dog now is 4 years old. All 4 pounds of her is 4 years old. And we've noticed that all of a sudden she'll kind of migrate. If we're in the bed and have a mat on or we're doing something, she'll migrate over and kind of lay on the mat and feel good and keep her agility in place and so forth. She's very timid, so we don't know really what agility is with her, because she doesn't get very she would not do well in agility trials because she's just so timid. But anyway, we've just kind of noticed her migrating to the to the mats when we're using them. You're welcome for the comments, folks. We certainly appreciate that. So if you have another question, please put it in there. My goodness, it's 48 minutes already. We're flying along, and we've had some good calls and some good questions, and that's what it's all about, to help you get your questions answered and take care of your clients and keep everybody happy when it comes to the MagnaWave and the PEMF. Let's see, do we have any other calls here? Nope. 502-599-9722. And I'd be happy to answer any questions that you may have. Let me just make sure. Sometimes I get to looking and the questions I miss them, and I don't want to do that. Has Robert just asked to join? Let's see if we got a, yes, sir. Hello. Let's see if I can answer this. Can I answer? Did I lose you? I had someone calling in on Castbox, and I think I lost him. Let's come back. Let's see if I can. Okay, Robert, try that again if you would, please. And we'll maybe get you online. Robert asked a question, wanted to join me in a conversation. Let's see if I can bring him up. Waiting. Maybe he'll come on, join me. Hello. Do I have you? Hello?
Yes, I'm here.
Yeah, I'm having trouble hearing you. Go ahead. What is your question?
Actually, I'm a backflow therapy practitioner, therapist. So, may I know what is electromagnetic therapy is all about?
You want to know what it's all about?
Yeah.
Okay, basically, pulsed electromagnetic therapy creates a magnetic field that penetrates the body, and it allows the body's blood to be better oxygenated, to flow better, to have a better blood flow. And so if we can improve oxygenation and blood flow, we can allow the body to be in a position to better heal itself. And that's what basically the PEMF does.
So, have you ever came across the term like backflow therapy?
What?
And magnet therapy as well. I have came across that, and I have studied a little about magnet therapy.
Magnet therapy?
Yeah.
Yeah. You talking about static magnets or powered magnets?
Powered magnets.
Powered magnets? Yeah, and so it would be probably some. I don't know the specific brand that you're talking about, but it can, any type of magnetic therapy could be very beneficial for the body, for the healing process. And so, but what I'd recommend is take a look at PEMF and see how it compares to what your experience is.
May I know what is the difference between the powered magnet and what's the other thing which I stated?
I'm not. Can you type that into the message?
No, I couldn't differentiate the difference between the two, and the mentor suggested some magnet, but I don't know which was that. And what is the difference between the magnet therapy and the electromagnetic therapy, pulsed electromagnetic therapy?
The difference between magnet therapy and electromagnetic therapy is the penetration. Electromagnetic therapy can penetrate deeper into the tissue, whereas static magnets rest on the surface and don't penetrate as deep. Does that help?
Yes. Can we treat any emotional disturbances with magnetic therapy? Electromagnetic therapy.
Magnetic therapy, PEMF, he's asking if we can treat any emotional situations with PEMF, and PEMF has been studied and is being used for PTSD or depression, anxiety. So because it does provide a sense of well-being in many situations. So there are some studies that are going on to deal with the emotional state of depression. In fact, there are machines approved by the FDA to treat depression and the emotional health.
But does it come under alternative therapy? Alternative or complementary?
Yes, I would say that it can be very complementary to other therapies.
Because I'm already practicing one of the complementary therapies, so that's why.
Yeah. Well, that's great. Hey, thank you so much for calling in.
Yeah, sure.
Okay,
It's
bye-bye.
a pleasure to speak with you.
Nice to speak with you. Thank you so much. Bye-bye.
Thank you so much.
Okay, a great question there by Robert. That's really one of the first folks we've had come into us through Castbox, and need to work on the volume there a little bit so we can get it up so everybody can for sure hear it okay. I trust that you were able to hear that okay. You might let me know a little bit. Yes, whole health and wellness responds. PEMF is great for moods and depressive anxiety issues. Great results. And yes, we've had some folks close to home with some PTSD issues, and we've seen very good results in the same type of situation as well. Jason's with us this morning with a smiley face. Jason, thanks you for being with us. We always appreciate when Jason's around. Okay, we're running close on time here. If you have a question, simply put it in the chat box. I'd be happy to answer it. If you'd like to talk to me, 502-599 9722. Let me make sure I got that right here in my 502-599-9722. Excuse me, and I'd be happy to visit with you and answer any questions that you may have. We got about 5 minutes left, and so if you have a question, put it in there, and we'll be happy to have a look at it. Again, we have several people with us on Castbox this morning. We're excited about that, and hope to visit further with the Castbox community as we go forward. And certainly we always enjoy being with you here on Facebook and YouTube and so forth, and answering your questions and just having a good conversation. A lot of good things happening. That study I was telling you about with Dr. Lyons and the concussion is very favorable, very exciting to move in those directions and to talk further. And certainly when we're dealing with flu-like conditions, congestion and sinuses and things like that, we've seen great results with people having a relief of some pain and discomfort utilizing the PEMF. And so creativity is the key in many of those types of issues and situations that one may be dealing with. Just a couple minutes to go, so if you don't have any other questions, we'll move on with other things in our day. And if you do have a question, I'll wait here for another moment, and we can hopefully get your question answered or have a conversation as it may be. It's been fun to be with you. Looks like things have slowed down. So listen, I want to thank you for being with me. I look forward to being back next Tuesday. Don't forget, hashtag thankful for my MagnaWave posted in the Facebook page, and we'll be having a drawing for a winner who's the exciting why they're thankful for MagnaWave. Dolores, thank you for being with me this morning. All of you, thank you for being with me this morning, this afternoon now. But we certainly have enjoyed it very much. So wave on to better health. Have a great day. Have a great week. And we'll talk to you next week. Thank you. Bye-bye.